So I would like to welcome Meghan Mandville Paul, all the way from Ontario in Canada. Dental hygienist, mum, wife, and author.
Yeah.
So get it in quick.
Yeah.
So I would just like for you to just kind of tell us whereabouts you live in and what you're currently doing professionally to begin with.
So I'm living in Bowmanville, Ontario, Canada. I have been a hygienist for 16 years now, and recently upgraded my education with O'Hare University to get my bachelor. And I've been working towards a public health aspect. So I'm starting in a community care facility in Mandville soon on Fridays for the public health. And I've recently written a children's book, which I hope will alleviate dental fear in children.
Sure.
Most of the I find going towards, your first appointment, what's happening at the first appointment. But if, unfortunately, if they do have a filling or a cavity to be done, there's not a lot out there on the steps involved.
Sure. So you are working 5 days a week?
So I teach dental assisting at a college in Oshawa. So I'm teaching 2 mornings a week, and I'm in private practice 1 day a week, and community care 1 day a week.
That's a nice mix.
That's
a really nice mix.
Yeah.
Cool. And then you're a mum as well.
Yes. It's Scarlet and Weston. So Scarlet is 9 now, and Weston is 6.
Cool. So I should imagine that keeps you pretty busy.
Yes, very. Yeah.
So what was your first kind of thinking process to actually getting your degree with us?
I always knew I wanted to upgrade my education. Once I finished hygiene in 2006, I immediately started towards my teaching certificate. So I have a certificate in teaching and training adults, which I finished in 2008, and taught the hygiene program, assisting program since part-time. Faye and I, my coworker, Faye Reed, who also took the course, we came upon O'Hare University, and we loved the process. It was very challenging, but really worthwhile in the end.
So you graduated recently, didn't you? Was it last year?
November 2020. Yes.
Cool. Yeah. So then you were beginning to write a book then, or was that happening during or before you finished your degree?
So the book, I think at graduation, I might have mentioned that I was working on it, but I was really working with the illustrator at that point. So I found a lady in the Ukraine that I really liked her, how she created her character. So she was, sending me each picture as we go, and we were working together. I think at one point I realized, the doctor doesn't have loops on, let's add loops. And then I had to show her different things because she doesn't have a dental background. Sure. But one book I really liked is that she showed the people smiling behind the masks. I did create this pre-pandemic, so notice even in the waiting room, people aren't wearing the masks, but I just wanted the children to see, what's going to happen and things that they might experience once they come in for appointment.
So what was your initial inspiration to actually decide that you wanted to write a book?
So for my daughter, I know it probably seems a little bit different that a dental hygienist is showing, it's a real life experience from my daughter, Scarlet. When her teeth came in, they came in with deep pits and fissures. So even the deepest or the best toothbrush in the world wasn't going to reach those pits and fissures. So I knew, they would have to be repaired. So I think just, letting them know that I wanted to get it across that if your child does need to get a filling done, here's the steps involved and here's what you can expect. So I thought it would be a nice read before bed, a couple of days before the appointment, to prepare the child for what's going to happen.
Sure. Have you experienced professionally, have you experienced parents not fully preparing their children for these appointments?
All the time. All the time. And sometimes even maybe even raising their anxiety levels because they're saying, you know, their experience with it. I really tried to stay away from the word needle, the word poke, the word discomfort. I use the word sleepy juice. I just find that a little bit nicer for them, that yes, the tooth is going to be asleep for the appointment. It's not going to feel anything. Just I stick with the buzzwords because, you know, before appointment, their imagination will run wild, and, you know, the needle.
Sure. I mean, I used to find that parents used to say things like, it's not going to hurt. So immediately children have got this perception that, why did you say that? Why even go down that route, you know?
Exactly.
Yeah. Maybe we need to write a book about what things parents can and shouldn't say to children leading up to dental visits.
That's a good idea. Yeah, the buzzwords. I hope to segue into another book about just how cavities form for kids, because there's a lot of disconnect. I find they're thinking, you know, you have to have tons and tons of sugar all day long in order to get a cavity, which there's different ways that can happen, and there's ways to prevent it. I didn't really dig into that. I just went into, she has a cavity and here's what's going to happen in her appointment. She was nervous. In the end, she was okay. Everything went well.
Sure. That's really, and it's I've got to say, I've read it.
Oh yeah.
Got it here. And it's a really nice book, and it's really nicely written, and it does say the right things from a clinician's perspective. And I really like the photos, the pictures. They're great. They're really great. And you're right, that's quite clever to get a smiley face underneath the mask. That's a really good idea.
Yeah, I feel like with the pandemic on right now, it's the kids' reality is to see facial features behind a mask. And I just, you can tell when smiling with their eyes, but I just wanted to show that, you know, they really care. They're looking out for the child, and it's a warm environment. This is the dentist that she actually goes to, Dr. Sunny, at my work. So I showed it to her, and she really liked it. She didn't know I was writing the books. She really liked it. Yeah.
Fantastic. So where can people get hold of it?
So it's on Amazon right now, under Scarlet's First Cavity, 1T. Yeah. I know you can spell Scarlet ways. And it's also in a Kindle version and in the paperback currently. And yeah.
Bro, I think the only issue I'd have with the Kindle version is you really won't get the pictures that you have in the hardback. I urge people to buy the book, the paperback copy. Yeah. I mean, and that's much nicer as well when you want to sit down with a child and to read a book to a child and with a child. It's much more of a personable thing, isn't it?
Yeah, and as they're observing the photo, the parents are really reading all the contents. Imagine what's happening. Yeah.
Sure. So have you got an age range in mind with that story?
I think it can go anywhere from, 2 to 8. But yeah, that was my initial thought on there. Whenever they might have their first cavity to get filled. Hopefully they don't have any cavities, but if they do, this is a good, like I said before, but before bed read, so that they can ask questions to mom and dad. And one of my aunts read it and she's like, I had no idea this goes on at the dental office when I get a filling. I didn't know what that blue light was. I didn't know, what's happening during the filling. You're just like kind of laying down. So, it's informative even for the parents.
Wow, that's really interesting. We assume a lot, don't we? We assume
do.
that adults really know what's going on. Maybe we should have grandma's first visit to the dentist.
Yeah.
With a cavity.
Yeah.
So what's your future plans then?
I think I would like to, I have a couple of ideas floating around in my head about a book about how cavities form. I really, really want to get across the fact that most parents, I wouldn't say most parents, I'd say 50% in the practices I work in, they think if there's a cavity in a baby tooth, it's okay. It's just a baby tooth. It's going to fall out. So I think diving into eruption dates and diving into how cavities form in a nice, playful way with really good illustrations, just to kind of teach them about, the fact that some of the teeth won't fall out till they're 12. And if they have a cavity in it when they're 6, chances are it's going to go down to the permanent tooth underneath. And, just those kind of things that they really don't show you.
Yeah.
I also idea for the hospitals in the region. I wanted to create kind of a little pamphlet. When you get a baby, you get a stack about this high and stuff to read about on your, how to take care of baby, everything from life insurance to, everything about taking care of the baby, but nothing on the teeth. So I thought I'd also like to create something for the hospitals so that they can have that, how to care for them, how to clean out the mouth after feedings, things like that, just so it can start early.
Sure. I'm astounded that information isn't there as a priority.
I know.
Yeah. Because
within 4 months, sometimes the bottom 2 insides are sprout up, and then the sugars from milk, there's a lot of disconnect in knowing how fast a cavity can form.
Sure. That's really interesting. I've learned something today.
Yeah.
Every day's a school day. So
yeah.
So where will Meghan be in 5 years' time? What will you be doing?
I'm hoping working, having a more primary role in community care. The current outreach center that's located in Belleville, we are delivering care to people who don't have insurance, and we're also delivering care to people who are in Canada. We have a Healthy Smiles program, so it's for people with income less than $30,000 a year, where their kids can come and get dental work done. So it's government funded. I'd like to take a more primary role in community care and outreach.
And keep writing books.
Yes.
I've finally got to ask you a question. What would you say to anybody that would be thinking of studying with us and doing their bachelor's through OHU?
Do it. Don't wait. There's no good time to do it. I know you can make lots of excuses, but I have 2 kids. I work a lot, and the night times were my times to work on my university degree. And I found the teachers were very supportive. I loved our Wednesday meetings. Sometimes our Zoom meetings, our 2-hour Zoom meetings, would go longer because we'd just be chatting about practice. And I learned a lot from that time as well. So I say, don't wait, definitely register. It's a really, really good program, and you'd be surprised at how well you can do in such a short period of time.
Yeah, thank you for the positive feedback. We get a lot of people saying that they had outcomes that they couldn't have imagined before they started. So
yes,
that's nice to hear. So I thank you very much for your time, Meghan.
You're welcome.